I shall be presenting our work titled Selective Endotheliectomy in Peters Anomaly, acronym titled SEPA, the long-term clinical outcomes in 34 eyes of 28 children with Peters Anomaly. None of the authors have any proprietary or commercial interests in any of the material discussed in this particular study. As we all know, Peters anomaly is the most common anterior segment developmental abnormality, presents with central or paracentral corneal opacification. It accounts for nearly 50% of the children born with corneal opacity. Bilaterality is seen in two-thirds of the cases. Incidentally, it is also one of the most common indications for a corneal transplantation among congenital corneal opacity. This is a typical case of type 1 Peter anomaly with a posterior excavation, which is evident on an anterior segment OCT as well. In this particular instance, wider zone of cornea is involved. On UVM, you could actually see the perimeter of the corneal opacity having a synovial attachment, which is clearly evident on horizontal and vertical scans of the UVM. This is the typical case of keratoirodolenticular dysgenesis, where right and left eye of the same child, where left eye has a severe involvement with the cataract. While conservative approach applied in a milder variant of Peters anomaly, where surgical interventions are typically resolved in a severe cases of Peters anomaly, often have a abysmally poor outcome. While small subset of milder Peters anomaly tend to spontaneously recover over a time, but majority may not show a discernible clearing owing to presence of anomalous layer as shown in this particular slide. Histopathologically, the posterior defect filled with a uveal tissue and anomalous fetal membrane, as evidence in these histological slides. Perhaps this particular layer inhibits the normal endothelial migration, thereby preventing the spontaneous recovery. Based on our clinical as well as histopathological observation, we felt there is a focal area of anomalous Descemet's endothelial complex underlying the posterior defect, which perhaps serve as a contact inhibition. Once we remove those anomalous layer, the perilesional healthy endothelium tend to regenerate and fill the denuded area, lead to the resolution of the corneal edema. And also robust scar remodeling in children together with overlying well-preserved anterior stromal architecture helps in the rehabilitative journey of a child. We documented the postoperative healing response after SEPA using high-resolution anterior segment OCT. At 1 month postoperative follow-up, DM is not only well opposed, the endothelium was covering the defect, which is sharply demarcated. Together, clinically, we could actually perceive stroma is much more compact and transparent postoperatively. Our intent was to determine the functional success of SEPA in children with Peters anomaly. This was a single-center retrospective consecutive interventional case series. The study included 34 eyes of 28 children with visually significant Peters anomaly that had undergone a selective endothelial removal with or without additional procedure. The study was conducted at LV Prasad Eye Institute, Hyderabad, India, over a period of 8 years between 2012 and 20. Based on the location and extent of the corneal opacification, the corneal opacity can be categorized into the zone 1, which is a central island of corneal opacification within central 6 mm. Zone 2, central cornea with a peripheral cornea is involved. Zone 3A is a near total corneal opacification. Zone 3B, complete corneal opacification. This is a technique demonstrating selective endotheliectomy. Step 1, severing the communication between iris and cornea. Step 2, identifying the actual defect. Third step, delicately removing the anomalous corneal endothelium without disturbing the integrity of Descemet's membrane. Step 4, checking the integrity of Descemet's membrane. There was no Descemet detachment at the end of surgery. Type 2 Peters anomaly, wherein additional lens aspiration along with sphincterotomy was considered in view of a large corneal opacity. The sequential picture collage of a milder variant of Peters anomaly, right and left eye of the same child, showing the postoperative corneal edema resolution with a scar remodeling as observed over 18 months period. In contrast to the top row, wherein had an extremely good outcome with a smaller zone of corneal involvement. The bottom two rows had a wider zone of corneal involvement that resulted in a suboptimal outcome following this intervention, which was observed over a period of 6 months' time. The sequential picture collage of severe Peter anomaly, top and bottom row showing a significant improvement in eyes with a smaller zone of corneal involvement compared to the middle two rows where corneal opacity is much larger along with a cataractous lens had a suboptimal outcome with a secondary glaucoma. Meaning even in a type 2 Peters abnormality with a smaller zone of corneal involvement can help achieve a good outcome. Primarily, our cohort included a type 1 abnormality. Median age at surgery was 7.2 months, and 85% had a discernible corneal clearance. So the 97% had ambulatory vision, and BCVA significantly improved owing to the resolution of the corneal opacification. On careful evaluation for the factors responsible for a SEPA failure, we found that one is severity of the disease, the zone of involvement, and additional intervention seems to be the important risk factor for the non-resolution of the corneal edema. 85% of the mild to moderate cases had a significant corneal clearing in comparison to the severe disease. The cornea tend to clear even beyond 12 months, so perhaps this may be related to the remodeling ability of the younger children. Over the last 3 decades, the literature primarily focused on anatomical success has shown a modest outcome, and only 20 to 60% of them achieved a 2400 or a better vision at a median follow-up of 4 years. The current study, where most cases have actually showed a significant improvement, and vision is continued to improve over a period of time. Our study validates the long-term outcome of SEPA. It's a novel, less invasive surgical strategy for the treatment of PRS. In 85% of the cases, opacity is significantly cleared with a marked improvement in the visual functions. We've also demonstrated to the best of our knowledge for the first time that SEPA can be used even in cases with the severe form of keratolenticular adhesion as long as the central corneal opacity no more than 7 millimeter, or at least half of the peripheral cornea has remained clear. The findings of our study questions the prevailing paradigm whether this procedure could be offered as a preferred surgical modality in every case of Peter anomaly, or only in a select cases where corneal opacity less than 7 millimeter, irrespective of the type of Peters anomaly. The long-term results are extremely promising, can be a very effective surgical alternative to penetrating keratoplasty, and this would benefit hundreds of children with Peters anomaly related corneal blindness worldwide. Thank you for your kind attention.